Today on The Confident Patient in a New World, we are joined by a special guest in the media who has been covering healthcare for over 20 years. We're really looking forward to this conversation. I'm Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. I am joined today by my colleague and co-author, Wendy Benson. It seems like every time we read the news, we're faced with new guidance about how to be healthy and stay safe in our changing world. Skip Weiss is the award-winning publisher and editor of Chicago Health and Caregiver Magazines and founder of Northwest Publishing. Thank you for joining us, Skip. Wendy, there are lots for us to cover today, so I'm going to let you take it from here.
Skip, we are so pleased to have you with us today. Thank you so much for joining us.
Thank you for having me. Delighted.
So we've known each other for years, and I know a little bit about your story in terms of you being from Chicago your whole life, spending lots of time and energy here, founding Northwest Publishing in 1998, and since then doing Chicago Health Magazine, Chicago Caregiving Magazine. Both of those are online now. Tell us a little bit about how you got your start in publishing.
Well, actually, my interest started in high school, carried on for a long time. But my actual start in publishing was in the hospitality area, which is a theme that's been relevant in my family for so many years. And it started with a magazine called the Chicago Collection. That morphed into Chicago Health, and Chicago Health then morphed into caregiving. They've both been, the last two titles have been a real passion for me as our world has increasingly demanded more services for health and more information to make choices.
You know, I feel like healthcare as an industry just has always evolved significantly, obviously over the last year and a half, even more so. What have you seen in the Chicago landscape that has really changed in the healthcare news space over the decades that you've worked with it?
You know, it's what's interesting is that, you know, Chicago's problems are not unique to Chicago in many regards. Every city has health needs, but Chicago has an enormous, diversified healthcare system. Which is a great benefit to all of our neighbors who live in this 10 million SMSA. So we really have a great asset in that. There's a couple of things that are different, certainly in our market. We have because of the kind of demography we have here, we have a terrible issue with health disparities, and that's something that we end up covering. And because of the infrastructure, the aged infrastructure in the Chicago market, we have other issues that affect health, like an aging water supply system. We've written about that, and hopefully those kinds of issues will be addressed in the future. But those are some of the differences that we see.
You know, as you know, I'm a huge fan of the information that you and your team put out. Like, I just think that it's informative. I think that the artwork is just simply gorgeous. I think that you and your team do a tremendous job. So I'm somebody who's been looking at Chicago Health for years, and I was really excited when you shared with us last year that you were going to be debuting the Caregiving Magazine. Tell us a little bit about the thought process that went into bringing that to life last year.
Well, it's interesting. I've been, a lot of my colleagues that I've met in the last 5 or 6 years have been in the senior space. And the more I've gotten to know them and gotten to know more about their work and the people that they work with, their clients, it dawned on us that this was a really important area that really wasn't covered. One colleague said to me at one point, you know, when my husband and I were young parents, there was a parent magazine and parenting magazine to help us raise our children. She said, now I'm about ready to take care of my mother, and there's nothing quite like that in the Chicago area to help us. And this was from someone who was actually working in the senior space. And if she found it challenging, imagine most people who the need arises, look at the situation like a deer in headlights. So there was clearly a need that I began to gather that we could fill with a new publication focusing less on health, like Chicago Health Magazine, and more on helping those people who live independently transition into living with some level of assistance.
In at 2x2 Health, I feel the exact same. I always thought that the people that would refer to us were outside of the healthcare space, lawyers, financial planners, but actually our biggest referral has been from physicians who and clinicians that know that there's this huge gap outside of the four walls of the hospital. And when you need a little more extra help, where do we go with that? So there is a huge gap there that what you're doing is really helping fill that. So thank you.
Thank you. What's been interesting over this last 15 months during the pandemic is clearly an increased appetite on most people for health information. We've been forced into it. We're been scared about the prospects of what could happen to us if we get COVID. And there's been a huge upsurge in traffic to our website. There's been a greater appetite for our printed material. And that's one of the other things that has changed clearly is that there seems to be more interest today in one's health and being healthier. And that's encouraging because it's one of the things that I was actually been surprised about over all these years is that I don't know that most people really do things to promote their best health, whether it's eating or exercising or just doing the other preventative things that will help us along the way.
Right. And I have to agree with Wendy too. She said the look of your magazine is something different, and I have to agree with that. You've done a great job. You kind of made healthcare a little sexy there.
Well, you know what? It's important for the magazine not to look or read pedantically.
Yeah, I like
it needs to be accessible, and I have a terrific team with a great aesthetic that gives it that look. And the stories are narrative. They're not just doctors, being quoted and terminology that you have to look up every fifth word.
Definitely relatable. Yeah.
We try to find a patient or somebody in somebody's care and follow their story. There usually then is some kind of an emotional impact, and that's the kind of thing that readers will feel and probably remember more. I
agree. Great job.
It makes such a powerful impact. And when circling back to the caregiving component that that you started last year with your new launch, I think back to when I had my children, and there were like new moms groups where we would come together, sometimes physically, sometimes on the phone, and support each other in this new part of our life. And I think that type of support, and you mentioned it earlier, like sometimes we can feel like we're out on an island when we're helping to care for people who are older. There isn't an automatic start date when we all had birth in the same month that we're going to join this group, which was that new moms group for me. Like, we're still in touch, over a decade later, we still, can chime in and help each other through some of the things that now kids are teenagers. But when we have our loved ones go through these other phases of life, we need resources and to help support each other. And you putting this out into the world is really is making a big difference and will continue to make just such a positive impact on people's lives. So thank you for doing that.
Yeah, thank you. It's the resource part of it is critically important. And while we don't have lists and lists of resources, we do have a resource section which will provide a list of the kinds of things that you might have to be in contact with over this journey. It will point you to other places to get lists, and certainly there's information on the internet. But we can't cover every story in a given issue.
Right.
So all of our material in print ends up migrating to the Caregiving website or the Chicago Health website. And Chicago Health now has well over 1,000 articles in it. Caregiving, it's only a year old, but it's growing. And so you can find most anything that you're looking for there.
Great. I know that you mentioned that, and this is what I like about the articles as well. Like it's often, has a patient in mind or a story where you can really connect with the person who's going through something. Are there, is there like a particularly memorable story or article that you or one of your team members focused on that just really like captures the essence of what you're doing?
It's a great question, Wendy. There's several stories that have really resonated to me as a human being, not someone who has gone through any of the issues, but just as a human being and neighbor in our community. 5-6 years ago, one of my great writers, Kate Silver, did a story called Needles in the Haystack, which was one of the first stories that came out locally about the opiate problem in Illinois and the state's inability to fund treatment programs. It was a huge story at the time, won national awards for this little new upstart, and it was really exciting. And then more recently, last year we did a story on health disparities within Chicago, and David Ansel from Rush was one of the principal leads in this story. And then there was another terrific story about learning from the dead. Friends of mine who my buddy had passed away and had decided rather than be buried or cremated immediately, would donate his body to science. And the story took the reader through and my writer through the morgue and through classes to see what that was all about. And those were pretty significant stories and examples of the kinds of things that we'll do in features. In Chicago Health, we'll always do some content on orthopedics and heart disease and cancer. And those are important, and over a period of time, we have a great depth within each of those categories. These one-off stories, though, I find fascinating and different, and you usually don't find them elsewhere.
So you've been doing this for years, and what lessons have you learned over those years in terms of working in and reporting on healthcare? Any last pieces of information you can share with us?
A couple things, I guess. One negative and one positive. The negative, I think that I've been really amazed at how few people, and that's not to say, well, I'm surprised how few people take seriously their health. That the only time they seem to take seriously their health is when there's a problem, as opposed to knowing what it is to live a good and healthy life and doing things along the way that will provide a more enjoyable, strong, healthy life ahead. There's been just too many people that I know that haven't taken care of themselves and have issues or have passed. But on the flip side, one of the things that's been amazing, and even before COVID, was how rapid advancements are in the health world to help us get better, stay better. And then during this COVID experience, it was mind-blowing to me to see how quickly we were able to create, as a society, a vaccine, which suggests that if we could do it with COVID, if you could marshal the resources the way they were done with these vaccines, what can we do going forward? And I would suspect that there's a lot of great things ahead for us.
I love that. Very inspirational.
It is. Well, thank you, Skip Weiss, publisher and editor of Chicago Health and Caregiver magazines and founder of Northwest Publishing, for taking time out of your busy schedule to be here with us. You can learn more about or subscribe to Chicago Health and Chicago Caregiving at the sites listed here. In the meantime, be sure to check back with us as Wayne and I continue our conversations with medical experts as we help the confident patient in a new world.
Skip, thank you so much for your time. And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.
Bye-bye.
You're welcome, and it's been a pleasure.
Thanks, Skip.